Hey there, I'm Dr. Leona, and welcome back to another amazing episode of the Hilldale Podcast. I'm so glad you're here. Today, I'm going to talk about something that not only frustrates me, but also many of the clients that I have worked with. Picture this: you're exhausted every day, the scale keeps creeping up, your hair is thinning, you drag yourself to the doctor, desperate for answers. They run a bunch of tests, then come back smiling, saying, "Good news, everything came back normal." But you don't feel normal. You feel terrible. And now you're wondering, is this all in my head? If that's ever been you, this episode will be a game changer because today we're talking about why normal labs don't necessarily mean healthy, and more importantly, what you can do about it. So go ahead and grab a pen and some paper because I've got some insights that may completely change how you think about your labs. So get comfortable and let's seal the deal to heal. Welcome to the Hilldale Podcast. I'm your host, Dr. Leona Allen, and I'm here to help you achieve more freedom in your health and your life. I'm the founder of Freedom Health Systems, and I've been a licensed chiropractor and wellness coach for over 2 decades. I've helped men, women, and children transform their lives by removing the physical, chemical, and emotional barriers to natural healing. Every week, I'll be taking you on a journey where you will discover the real truth behind what it takes to heal your mind, body, and soul. Allow me to be your guide as you travel this road to renewed health and a new life. It's time to make a deal with yourself to heal yourself. Please keep in mind that this podcast is for educational purposes only and not to be used as a replacement for medical diagnosis or treatment. With that said, let's begin. When your doctor says your labs are normal, they're not saying you're healthy. They're saying you're average. And in today's world, average is pretty sick. Here's how these normal ranges are actually created. Labs take blood samples from thousands of people in the population and find that middle 95%. Whatever falls in that middle range becomes normal. But here's the problem. That population isn't exactly the picture of health. We're talking about a society where most people are walking around with undiagnosed diabetes, thyroid dysfunction, chronic inflammation, and nutrient deficiencies. I see this every day in my practice. A woman comes in exhausted, cold all the time, gaining weight no matter what she does. And these are classic signs that her thyroid may be under strain. So her doctor runs her TSH and it comes back at 3.8. And because the typical lab range is from about 0.5 to 5.0, she's told everything is normal. But here's what isn't explained. TSH, which stands for thyroid stimulating hormone, is not made by the thyroid at all. It's made by your pituitary gland, a tiny gland in your brain that acts like a thermostat for your whole hormone system. Here's how it works. When your thyroid hormone levels start to dip, the pituitary raises TSH to push the thyroid to produce more. When the thyroid hormone levels become high, the pituitary lowers TSH to tell the thyroid to slow down. So TSH isn't measuring thyroid output directly. It's measuring the signal your brain is sending to the thyroid. Now let's bring it back to normal versus optimal. A lab might call 0.5 to 5.0 normal, but if your TSH is 3.8, that means your pituitary is already shouting at your thyroid to work harder. You may be losing hair, gaining weight, and feeling exhausted, all while being told you're fine. In functional medicine, we've seen that most people feel their best when their TSH is between 1 and 2. We also look into other markers such as total T3 and T4, free T3 and T4, reverse T3, and thyroid antibodies because one number from the pituitary can't tell the whole story of thyroid health. This is the perfect example of the gap between normal and optimal. Normal says you're in the average range. Optimal asks, is your brain and thyroid actually communicating in a way that makes you feel your best? I mean, even think about weight. Around 70 to 75% of Americans are either overweight or obese. Does that make obesity normal? Sure. Does it make it healthy? Absolutely not. This is why you can feel absolutely terrible while being told that your labs are perfect. The system isn't designed to catch dysfunction early. It waits until you're really sick or in a state of disease. So here's the bottom line. Just because it's common doesn't mean it's normal. And we can't confuse average with optimal. Your body deserves optimal. Are you doing everything right, but still battling fatigue, brain fog, and weight that just won't budge? Here's the truth. It's not your willpower, it's your metabolism, and I can show you exactly how to fix it. I just released a free breakthrough training that reveals why 88% of Americans are metabolically broken and the three-phase system that reverses it. If you're ready to stop spinning your wheels and start seeing real results, go to beginhealingtoday.com. Again, that's beginhealingtoday.com, and you'll also find this link in the description. Now back to the episode. Now let's talk about timing, because this is where the healthcare system really lets people down. Think of standard lab ranges like the smoke detectors that go off after your house has already burned down. They're set up to diagnose disease after it's already taken hold, not to warn you early. By the time your numbers move from normal to abnormal, you may have already been living with dysfunction for years. Let's take blood sugar, for example. Say your fasting glucose comes back at 95. Your doctor reassures you because the normal range is from 70 to 99, but the optimal range is really 70 to 85. So at 95, your body may be already struggling with insulin resistance. You may notice energy crashes in the afternoon, cravings for sugar, or weight gain around your belly. But you won't get labeled pre-diabetic until you hit about 100 or diabetic until about 126. That means you can spend years developing metabolic dysfunction while being told everything looks fine. See you in 6 months. And this isn't just about blood sugar. The same story shows up with iron, hormones, and inflammation. Conventional ranges are so wide that they only catch severe problems. I had a client who suffered for 3 years with hair loss and severe fatigue. Her doctor ran the typical tests, including the CBC, which includes things like hemoglobin, hematocrit, and red blood cell count, and said she was fine. And when I looked deeper and ran markers such as ferritin, iron, and saturation, the truth came out. Her ferritin was 62, which is normal. Her iron was at 43, which is way below the optimal ranges of 85 to 130. And her iron saturation, which is an indicator of how the body transports and utilizes iron, was at 14%. So functionally, this is early iron deficiency. Her body didn't look anemic on her CBC yet, but it was already struggling to get enough usable iron. This is what I mean by functional medicine, asking better questions. We don't wait for your body to be completely depleted before we act. We look for patterns that reveal dysfunction early when it's easiest to correct. Once her iron levels were restored, her energy came back and her hair loss stopped. 3 years of unnecessary suffering, all because no one looked beyond normal. This is the bigger problem. The conventional model treats you as either healthy or sick, but health isn't binary. There is a wide spectrum between thriving and disease, and most people live stuck in that gray zone, tired, inflamed, gaining weight and losing energy, yet told they're fine. This is where functional medicine completely flips the script. We don't ask, are you sick enough for treatment? We ask, how can we help you feel your best? That's where the optimal ranges come in. They aren't based on what's average in the population. They're based on extensive research into what levels support peak health, energy, and longevity. When I run labs on my patients, I'm not just looking for disease. I'm looking for the earliest signs that something might be heading in the wrong direction so we can course correct before symptoms ever develop. Let me show what this looks like in practice. Vitamin D is a perfect example. Most conventional docs consider anything above 30 to be sufficient, but functional medicine research shows that optimal vitamin D levels are typically between 60 and 80. So at vitamin D levels of 32, you're not going to get rickets, but you're also not going to have optimal immune function, mood regulation, or hormone production. You might find yourself getting sick more often, feeling down during the winter months, or dealing with hormonal imbalances, all because your vitamin D isn't truly optimized. When we get that same patient's vitamin D up to 60, suddenly they're sleeping better. Their mood is more stable. They're not catching every bug that goes around. Same person, same life, just optimized numbers. This is what I mean when I say there's a difference between not being sick and actually being healthy. Standard ranges can tell you that you're probably not going to pass away today, but those optimal ranges can tell you how to feel amazing. I've seen this transform many lives in my practice. Patients who've been told for years that everything's normal finally get answers because we are going beyond normal ranges. The goal isn't just to avoid disease. The goal is to optimize function, to help you wake up with energy, think clearly throughout the day, maintain a healthy weight without constantly fighting your body, to sleep deeply and feel emotionally balanced. You deserve to feel more than just not sick. You deserve to feel incredible. All right, beautiful people, let's wrap this up. Here's what we covered. Normal lab ranges are based on averages from a population that includes a lot of unhealthy people. These ranges are designed to catch disease after it's developed, not to optimize your health or catch problems early. And optimal ranges can identify imbalances years before they become serious health issues. If you're walking around feeling terrible, but being told your labs are normal, I want you to know something. Your symptoms are real and they matter. Your body is trying to tell you something important, and you have every right to demand answers. Here's what you can do right now. First, trust your instincts. If you don't feel well, keep advocating for yourself, even if your labs are normal. Second, ask your healthcare provider about optimal ranges, not just normal ones. And if they're not willing to have that conversation, consider finding someone who is. And most importantly, remember that lab results are just one piece of the puzzle. They should inform decisions about your health, but they should never override what you're experiencing in your own body. And if you're ready to stop settling for normal and start living optimally, check out my proven strategy at beginhealingtoday.com. And I'm going to close with this. Don't settle for normal. Go for optimal, because you deserve nothing less. And until next time, go out there and achieve more freedom in your health and your life. Take care. Thank you for listening to today's episode. If you enjoyed the show, seal the deal to heal by leaving a review, subscribing to the podcast, and sharing with a friend. Thanks again, and we'll continue the journey next week.